With over 500,000 people suffering with opioid overdoses in the U.S., the opioid crisis is so expansive, most people know someone affected. Recent responses to the opioid crisis have worsened the issue. While methadone treatment results in less heroin and less opioid use, it also may result in the patient becoming addicted to both methadone and opioids or heroin. Suboxone treatment is a short-term solution that causes a long-term problem, where patients are heavily reliant on Suboxone and therefore are not detoxed. Laws causing increased restrictions on opioids have created more problems. The laws do not address the lack of education for providers on innovative options in pain management. Patients may seek illegal sources when unable to fill the prescription. Fentanyl-laced illegal drugs are leading to a high rate of overdose deaths in patients than ever before. Effective responses can become more effective with the use of telemedicine. Detox clinics and other detox programs lack the ability to provide adequate psychological therapy and post-follow-up care to patients due to staffing shortfalls, and in turn are failing in long-term success. HNC Virtual Solutions video and consumer platform can increase access to follow-up care with patients to provide continued monitoring and improved compliance. Many patients live in rural areas where detox programs may be unavailable. HNC kiosks may be utilized for rural care groups to increase access points to psychological care, and also may be used to remotely manage the rehabilitation of patients. Community paramedic programs are at the front line of the opioid crisis and suffer from a lack of coordinated response. With HNC's community paramedic kiosk, patient data will be aggregated, analyzed, and integrated with EMRs to allow for better crisis data tracking. Also, with HNC's consumer model, patients visited by the community paramedic may be deferred to get follow-up psychological care via virtual video consultations with their own mobile device or computer. HNC Virtual Solutions offers a multi-platform approach to the response. The community paramedic kiosk is essentially a mobile clinic that allows for patient vital assessment, for example, blood pressure, pulse ox, weight, temperature, etc., which is immediately made available on our cloud-based provider portal. Physicians and psychiatrists can use the built-in video platform to bring post-care follow-up directly to patients, placing these kiosks in community centers and other publicly funded spaces. The telepsych kiosk may be placed in primary care facilities to open up access points for patient psychological care and remotely manage the patient's rehabilitation. The consumer model allows for managing post-care follow-up with patients through video consultation and custom workflow and surveys to track patient progress and compliance. In a study of 17,500 patients, only 30% received any detox medication and proper follow-up. HNC's telemedicine platform will improve access to specialty clinics in areas where this level of care is unavailable. A separate study indicates that post-care follow-up treatment for opioid addiction can help curb recidivism in 60% of patients over a 42-month period. Improving access for post-care via telemedicine enhances access to specialty clinics and improves compliance. HNC's various platforms provide a solution for follow-up care. With vital assessment, data tracking, and analytics, HNC can provide the data needed to coordinate a more effective response to the opioid crisis.